My name's Paul Veitch. I'm a nurse consultant here at the Trust, and I'm going to chair today's event. One of the things that struck me during the pandemic is just how much we've been exposed to the work of our colleagues. And most of us have had beamed into our living rooms scenes from critical care units and other parts of the general hospital, and the vital, important and much valued work of our colleagues in the acute sector. However, we thought that it might be of value, it will be of value, for those present to be able to have an insight into the work that goes on in our own inpatient services. And today we're very lucky to be joined by Dolores O'Doherty and Pippa Keith, two prior colleagues of mine in BEAD unit, an adult acute unit in St Nicol's Hospital, Newcastle upon Tyne. And Dolores and Pippa have taken the time to prepare for this session and to make themselves available today in what I know is an extraordinarily busy time for them. What we're going to bear witness to is an interview. Paul Nicol, who is a patient and carer, service user and carer facilitator. I did write it down, Paul, and I've messed it up already. So I'm sure you can give us your full title, and I'm sure you've got lots of interesting titles. So without too much more of ado, I do want to hand over to Paul, who's going to take Pippa and Dolores through a guided interview so they can reflect on the changes that have taken place in the ward-based environment since the onset and the continuing COVID situation. So return to me later on, but Paul, the floor is yours. Thank you very much.
Thanks very much, Paul. Thanks a lot. Really appreciate it. It's Patient and Carer Involvement Facilitator. Lovely title. Really like it. Thank you so much to Pippa and Dolores for having the courage to answer some questions and talk about life on an acute ward. How are you both?
I'm okay, thank you.
Yeah.
I'm okay.
Yeah.
Good. How's the ward been this week?
Well, recently, it's past couple of weeks, it's changed from being an admission ward to reverting back to an old acute admission ward to its original service. It's still very busy, but not as busy as it previously has been before them 2 weeks.
Right, so it's the easing off a touch, but it's still extremely busy in comparison. And you're both okay, which is good to hear. And it's good to hear that things are easing off a touch, even if it is ridiculously busy. How are you both managing to stay well then?
I think when we say we're well, it's one of those comments that you make when people say, "How are you today?" and you give a flip, "Oh yes, we're fine." But I think in reality, I think I'll let people speak for herself. But I do feel stressed, I feel tired, I feel exhausted. And it has been very difficult. You know, and this week, yes, it isn't quite as busy as it was with the admissions, but it still is a very busy ward with very unwell patients. And it's, even this morning, we've had a very difficult morning.
Sorry to hear that. Yeah, and maybe we'll get to find out a little bit more about that busyness sort of as we go on. Just thanks for being sort of open and honest about it, Dolores. You're right. So often we just say, "I'm all right." Yeah, I'm fine, and then on we go. And I suppose it takes courage, and it often takes like comfort within a team to be able to sort of say to each other, "Actually, I'm not so good today. I'm not so good today." How is the team sort of in supporting that, Pippa?
I think it can be quite difficult at times. I think when we were in an admission ward, coming into work, there was a variety of stressful situations. You know, there was high staffing levels, the levels of acuity of patients who were unwell was very high. You're coming to work and not know sometimes what you were coming into because of the rate of admissions had increased. So, and I suppose with regard to staffing, it was talking to each other, being there for each other, making the time to spend time with one another.
I think that's one of the good things about Bede Ward, and as we all recognise, it's very supportive. So when one person is struggling, everybody does rally around and support them as much as they can. And we still, you know, even though it's busy, it's stressful, it can be difficult, we can still have a bit of a laugh with each other. You know, despite sometimes when you're feeling so overwhelmed with stuff, somebody can still turn around and make you laugh, which really does go a long way to help.
Yeah.
Definitely. That's one of my favourite questions during lockdown. What's making you laugh? What's making you laugh during lockdown?
What's making us laugh during lockdown?
Sorry?
What did you say that? What's making us laugh during lockdown?
Yeah, what's making you both laugh during lockdown?
This is personally, but I keep getting my friends who I never really see, obviously because of lockdown, keep sending us videos constantly, funny videos that bombarding us with them. They make us laugh.
Yeah, it's just normal things, even just like the kids.
Yeah,
it's just normal everyday things. You know, you still see humour in it. Zoom calls that you have with friends. I had a Zoom call last night with some friends, and just those kind of small things that just keeps you going. Yeah.
And again, hopefully we'll talk more about sort of what's keeping you both going as we go on. Well, maybe it's now sort of like, what are you both doing as individuals to stay well? Like, how are you, like, obviously we haven't really talked about the ward yet, and that's going to give people a context as to just how busy you both are and how the pressures are there. I guess that we're starting to outline that a little bit, but like individually, what are you doing sort of to stay well?
Personally, for me, I would say having a routine and coming into work keeps us well. I've been very lucky to actually come into work during COVID. I think that staying at home would affect my mental health detrimentally. I've got 2 lovely children. They've been at school, and I've been very lucky for them to be going to school. Got good friends. And supported work from my colleagues.
What I'm hearing there is a lot of gratitude, you know, a lot of gratitude, which is good for well-being, you know, that it really is. Credit to you, Pippa, for sort of saying you're lucky enough to be at work, like real credit to you. And I think when we're starting to get more about the ward environment, we'll probably be taking our hats off 110%. How about yourself, Dolores?
I think it's very much the same, you know. Despite how difficult the ward is, and you know, this isn't just me and Pippa that says that. You talk to anybody in the ward and they'll say the same thing. Being able to come to work despite the days where you're wishing you maybe weren't there, we're all glad that we still have a job, because some people have lost their jobs. You know, we're getting a pay packet at the end of the month, and that we've got that routine, because that is just, and a bit of laugh. You know, I was talking to staff today, and that's what we were saying. At least you can still come and have a bit of a banter with people and have a bit of laugh with them. Have that, as Pippa says, have that routine. You know, have the still working with patients. Those things still help. And then being able to go home to your family, a nice, comfortable home, nice, happy family. You know, it's so, at times I guess it's the little things that means more than anything.
Again, I hear a lot of gratitude there. I really do hear a lot of gratitude, and I'm interested to find more out about that routine. You know, maybe that'll start to give us an idea of what the ward's like. What is that routine like? What is that sort of that daily routine that you both have, or the weekly routines that you both have, or the routines the ward has, and what does that look like? Sorry to put you on the spot with that.
It can change. I mean, obviously, we have our daily handover every morning, and that can last roughly about an hour or so of medication before that. We have occupational therapy wise, we would have a morning group with most of the activity coordinators will do that to find out what his patients want to do that day. And so the day activities will be set and written up. After handover, then it will be whatever jobs come out from the handover, getting those done, seeing individual people, maybe home visits. You know, it used to be that you would do a lot more community, linking people into the community, but obviously that's not able to do that anymore. So it's really just comes down to what the individual care plan that I'm working on with an individual person, and that can change greatly. Oh, sorry, we just lost you for a minute there.
Sorry, did I disappear? Was there a bit of a technology glitch there?
Yeah, let's hope it doesn't happen again then.
I'm sure you'll both be fine if I do disappear. I'm sure Paul will pop up and start asking some questions, so we're no need to worry about that. Thanks for that, Dolores. I think you've given us a bit of an insight into what the ward's like, and I'm just thinking about the busyness. Like, how could we get a sense of that? Pippa, have you got anything sort of day to day that like every day that people might be able to relate to that would help us appreciate just the busyness of the environment?
Yeah, so I mean, when obviously during the pandemic, when we came into work, as I said earlier, that the rate of admissions increased. So prior to the pandemic, or currently, we generally take about 1 to 2 admissions per week, once a fortnight. And I think when the pandemic was, although it's still on, it would, some weeks we could have to about 5 to 6 admissions.
Wow.
Which is quite a lot. Well, it is a lot of admissions, and then sometimes those patients would be staying on the wards. They might get transferred if they've had depending on the result of their COVID test. You may have to do a couple of transfers a day to different wards. You've got high levels. You may have high levels of observations due to patient security levels, depending on their set of risks. So that means their staffing numbers increase. Generally, we would work on 5, but during the outbreak, we could be working with up to 10 staff on a ward. I mean, that's got different implications for things like social distancing and but sort of like interspersed in between that, you've got the day-to-day run of the ward. So you've got medication, you might have meetings, might have tribunals, and you've got to spend time with patients as well while this is all going on. And it's quite a stressful environment to be part of.
And what does that mean for you on a really busy day like that? Like how does that impact on you as an individual? Like what?
It's difficult. I mean, sometimes you would come into work, you didn't get a toilet break later on in the afternoon, or I think one of the biggest things was not really getting a chance to speak to patients a lot of the time. Mm-hmm. You spend a lot of your time in meetings, in the office. There's always a task that you're doing, and that's taken away from that time that you should be spending with patients and a therapeutic engagement.
So because of all those tasks lined up with all of those people coming onto the ward, and let's remember, if somebody's coming onto the ward, somebody's got to go off the ward. Yes. So the ward doesn't just get bigger and bigger and bigger. So there's discharges as well as admissions, and they're 5-fold or 4-fold sort of larger. And then that's impacting on like even the chance to get the loo, and for yourself. But then obviously the chance to do probably the reason you came into the job, which is to talk with patients, support patients. Cheers for that.
I think that ends up leading to feelings of guilt. You always have this feeling of guilt and a level of anxiety that just runs through the whole day. But that sense of guilt that you're not doing enough, you're not doing the job that you know you could be doing, and not having that therapeutic relationship. And that's something, is prior to the admissions ward that we really prided ourselves on. We very much had a community feel, and we always talked about it in terms of it's not an us and them, it's very much an us community on Bede ward, and we worked really hard for that and prided ourselves on that. And through lockdown, I think we still are an us ward, but just in a different way. But we just, therapeutic wise, it just wasn't as therapeutic as we would have liked it to have been through no fault of our own. But it takes your toll. It takes a toll on staff when you can't deliver that care that you know you should be or you can do.
I'm hearing a few bits there. I'm hearing that the well, you're both sitting there in masks, aren't you? And obviously we're talking about the impact on the therapeutic relationship, and I can only imagine the impact that's having. But then that you carry that as the burden as staff members and worrying about and feeling guilty about that. Can you tell us a little bit about what it's been like with the sort of the social distancing, the well, not just masks, or that personal protective equipment that you've both had to wear, and how that impacts on the sort of the therapeutic relationship that you're talking about there, please, Dolores?
Patients have been really good in understanding, but it does take away that relationship whenever you know somebody wants to be near you. We have some patients that like to come right up beside you and talk to you, or they want you to sit right beside them, and you're having to constantly say, you know, guidelines, or that I have to keep my mask on. And I know one of the biggest things for me, particularly as an occupational therapist, is when you're doing your groups, you have to try and keep people at a distance, but you're not able to take your mask off, to eat with them, drink with them. You know, so such a simple thing whenever you used to do, I don't know, the mutual help meeting or the social lunch group, you'd be sitting there and you'd be having that conversation with them, building up that relationship, having a cup of tea, eating the same food as them. And that's one of the things that the patients were talking about. It's really nice that, you know, all staff for the social lunch would come and eat together, and we would have a drink together. And now we're not able to do that. We cannot take off our masks even to have a cup of tea in the same room as a patient, and patients do not like that. And when the outbreak was there, it was more difficult because you had to wear the full PPE. So you had the goggles or the visor, apron, gloves, and walking around all day, and that was really difficult. But I think also for patients, it was a real barrier, you know, and I think it intensified the feeling, the fear. So that was quite difficult. So it was good when we were at least able to get back to the mask. But patients, they have been very understanding, haven't they? I really can't praise them enough for how they've understood that we have to wear this, despite the fact that they would prefer us not to.
And I can hear that's the us, that it's still an us, that everybody's together in a similar situation and experiencing that's probably been a bit of glue that's kept the ward together as an us and kept that sort of aspects of that therapeutic relationship going, even with all those challenges. That's what I'm hearing. I'm mindful we haven't spoke about carers, so I didn't mention carers. I'm going to ask about carers in a bit, but I'm just thinking about that full PPE and outbreaks. Like, what are you thinking and feeling when that's happening, Pip? When there's an outbreak on the ward, I mean, just thinking about the how it feels, just knowing how close it is when numbers peak in general population, but to
it was really, I think it was scary, wasn't it? Yeah. I mean, having 5 or 6 patients on the ward with COVID, people have got their own pre-existing beliefs and concerns and anxieties about COVID. People are trying to protect themselves from this disease, and they're having to come into work where they're exposing themselves to it. It's just really difficult for people, really stressful, really anxiety provoking.
I know for the most difficult part was asking patients to stay in their bedroom, which goes against everything that we normally do in an acute ward. We want people to go out of their bedroom, but having to tell people they need to stay in their bedroom, their meals had to be eaten in their bedroom. That was really difficult to know. People are coming in, they're unwell, and then we're isolating them, you know, after maybe having months of them being isolated in the community without support, without their maybe work or families, whatever it may be. And then we're saying you have to stay in your bedrooms. But we did everything we could to support them. You know, we had the isolation boxes, activity packs. Staff would come and stand in full PPE, but stand and talk to them. We had iPads, television, CD players. We done shop runs. The activity, I must say, the activity workers were fantastic, and they baked cakes and stuff like that, and brought them around individual rooms and so on, and made sure they always had something to do. So we did everything we could do, but I'm sure that was not a good situation for anybody.
I can hear that. I really can. I mean, we know how illnesses can impact and isolate people, and then what I'm hearing is on top of the illness isolating somebody, that we're having to add to that. But it sounds like you've done as much as you could as a team to try and mitigate that and change that for people. Credit to you, absolute credit to you both and the team. The carers, I mentioned earlier, carers. I'm just wondering, we've heard a little bit about how it's impacting on staff and how it's impacting on patients. How about carers? Pippa, do you want to mention a little bit about that, or Dolores, whoever?
Yeah, I think prior to the pandemic, carers were always very welcome on the ward. We'd actively encourage them to come to the ward to support their families. But most wards would have like a monthly support group where you could socialise and talk about any problems that they had. And then it sort of just stopped because of the restrictions. And I don't know whether carers probably also felt quite isolated from their families and quite angry that they were being restricted. We initially couldn't have visits on the ward. And for patients, that would have been, again, more isolating. Very difficult for them. I mean, we've adapted, support people through telephone conversations, keeping them updated. But I think one of the difficult things was saying to carers, no, you can't come onto the ward, your son's isolating, you can't see them for 10 days.
What's it like telling a carer that? That must be tough.
I mean, we had one particular patient whose family would travel up, and I think we had to tell them sort of halfway here, you can't, you'll have to turn back. That was awful. It was really awful.
Mm-hmm.
Feel that. I can really feel how tough that was.
And we did let some, not at the outbreak, but we did let some families at the start come to the glass window, so the patient would come to the one glass side and they would come to the other, and even that was heartbreaking.
It was awful. Having a piece of glass between you.
Sometimes walking past is just absolutely heartbreaking, because you just imagine if that was your son in there and
you could
your
see
husband.
them but not touch them.
But again, I just marvelled at how patients accepted, that this was part of guidelines, and I think what helped as well was us able to say to them, we can't see our families either, and we'd be talking about how hard it was in the mutual health meetings and community meetings, that it's really difficult. We haven't seen our families for weeks or months and so on, and they were empathising with us as well. So
wow, that human to human, which is like how more therapeutic. I heard that bit earlier about the therapeutic relationship being difficult, but how more therapeutic than that human to human, just sort of relating. And I've got to say, Pip, you nearly got us with that description of the window. I don't know if it affected other people the way it affected me, but yeah, I got a real sense of how tough it must have been, sort of seeing that, and obviously more so how tough it must have been for the family and the patient. At the risk of asking too sort of sensitive a question, going back, we talked about the outbreak and outbreaks on the ward, and we quickly talked about how that impacted on patients and then how it's impacted on carers. What about you guys? You said it was scary, Pippa. Dolores, do you want to add anything as far as like just what that felt like for yourselves and?
We always worried whenever every day you'd come in, the first thing you'd be asking, is there anybody positive? And it was always a relief. And I think we felt quite lucky for so long. We didn't have any outbreaks, and I think we felt we're very lucky. But then to come in that day and find out that there was somebody on the ward, and the person wasn't isolating, and that was really scary, seeing the person walking around and them not isolating, and you know, they were unwell, you know, so they weren't following our direction to try and get them to isolate, and eventually they did end up in seclusion for a short period of time. But just that thought that you're going to walk out to the ward and, you know, where have they touched? But at the same time, you know, you had to help out. So it was all hands on deck. So I was in cleaning the kitchen, as was the band 4 with me. We were cleaning kitchen. Nursing staff were cleaning handles. We were, you know, we were helping out the cleaners, trying to clean everything once he was in seclusion. But it was then fearful because we knew that patient had been in close contact with other patients, and we have some very vulnerable, physically vulnerable patients. So you were really worried that these particular few patients that were more elderly, more vulnerable, what was going to happen with them. And then it's that thought when you're lying in bed at night thinking, have I got it? If I do get it, will I die? Even to the point where it's like, what can I put in place for my kids? What will they do? You know how in the middle of the night you let your mind go? Yes, it was a horrible time.
Cheers, Dolores. Pippa, you were nodding away all the way through that. It obviously a lot of it chimed with how you were thinking and feeling. Do you want to put it in your own words as well, please?
I was just thinking about the ward domestic and how she really stepped up. She was amazing. Just was always there cleaning. And I suppose it's not just about the immediate staff that you work with, it's about supporting the other disciplines who are coming onto the ward, and everyone did support each other. Even just going for a socially distanced cup of tea in the staff room was it was a reward, yeah. And
then how do you deal with that bit that Dolores has just said there about you like going home and our minds race when we get anxious, and then we start thinking about worst case scenarios, and and then you've got to get up for work and do it all again, and then come in and not know if somebody's unwell and
I mean, it was difficult not knowing that what you were coming into every day. And as Dolores says, that first question was how many negatives you got, how many positives. When I was just speaking to one of my colleagues today, and she said that what she found really stressful was we'll have like an isolation area and the doors swing shut, so you can change the use, so you could have one positive and so many isolating. But it was incessant, so it was difficult to keep track of what was going on in that area, and it was difficult to making sure that everybody knew what was going on, who was positive, who was isolating.
So you've got this busy environment that you're working on a year ago anyway, which is just like, I mean, I'm not sure people who haven't been on a ward can really fully appreciate just what that's like. And then you've got the complexity and the additional people admissions and discharge and extra work to be done, and then this whole new system intertwined in that as well about how to keep people isolated. I mean, how do you keep people isolated on a?
It used to make me brain. Because I mean, there was a PPE room. You had to go and put your PPE on, and then people had isolated in their bedroom. You had to encourage them to stay in their bedroom. People who didn't realise the seriousness of COVID or didn't think that COVID existed. It was just so many different scenarios that you had to deal with. And sometimes a scenario would come out and you think, oh, I've never dealt with this, wasn't it?
And I remember there being the time when there was a guy I took out on a home visit, and yes, we had our masks on, but when we were at his home, he was incontinent and he was unwell. So me and the band, you had to be close to get him into the car. He couldn't get in, you know, and you had that feeling like, oh, I know I'm not allowed to be that near to somebody, but I haven't got my full PPE on. But when you've got an elderly man and he's saying I can't get into the car and help me and he's stuck, there's nothing you can do. And I remember being right up close to him, and all I could think was, oh my God, please don't you be having COVID, because you know I'm right up close. But there was nothing you can't just you can't say no to your patient whenever they're frail and they needed your help.
Thank you both so much. To the Paul V has arrived on the screen, which I think means that our time as a conversation's up, but I'm sure, just thank you so much for what you've shared there. I'm sure it'll have given people some thoughts and questions that people want to ask you both. Just thank you for being so open and honest and candid in the conversation we've had so far. Really, really appreciate it.
Thanks, Paul.
Okay, so thank you to Paul. It's confusing having two Pauls. Thank you to Paul Nicol and to Dolores and Pippa. I begin to know now why the BBC don't come to mental health units. It'd be very difficult to capture that, some of the stories you've told us there. We have got some time set aside for questions. Caroline Severs, you have your hand up.
I do. I couldn't resist. No surprise there. Hello, Dolores. Hello, Pippa.
Oh, hi.
Hello.
Nice to see a friendly face that we know.
Yes, I thought as a fellow acute nurse, I'd come on to say thank you. I really thank you for sharing that. I really appreciate that. It was interesting to hear from one acute nurse to other acute nurses and professionals. And I'm just wondering, I kind of managed an outbreak as well where I'm working at the moment. And I'm wondering, we talk a lot about lessons learned and things like that, but I'm wondering how as a team that you might have changed, how the dynamics between yourselves, because I suppose it would be interesting for me to compare from ward to ward, what, if anything, was different or what you learned about yourselves as a team together.
That's difficult. I mean, throughout the pandemic, the team changed, didn't it? It was.
I think we definitely are stronger as a team, and I think people seem a bit more confident in what we're doing, because at the start, I think there was a lack of confidence, a lack of knowledge, scared in case you did the wrong thing, or what does the guidelines? The guidelines change so much. Yeah. But I think a level of confidence is definitely within the team, because we're a bit more aware of what should be done, what shouldn't be done, and challenging things whenever we see that it isn't right. To keep the ward right, keep the ward safe.
Yeah. No, that's reassuring. That's reassuring for me. Thanks. Nice to see you both.
It's interesting, Caroline's question, because one of the things that struck me during the earlier part of the pandemic was that there was advice on top of advice on top of advice, and I wasn't in that situation personally, and I think just trying to keep up with that, and it's very interesting that fear of getting it wrong, and how that could take away one's confidence. I've got two questions here I want to fit in before we go. Layla, I don't know, you've put a question in the chat. I don't know if you want to come on the video and ask your question out loud. Thank you.
Yeah, I was just wondering if things had changed since the earlier peaks in the pandemic, and if it was getting any better, and also if you know how it's going to be going forward, as hopefully as we're taking baby steps out of this, if that's reflected on the ward at all.
Yeah, I think it's now we're much more confident, aren't we, in how we manage sort of wearing all the PPE. It's become sort of second nature now. I think when it's very fit as mental health nurses, we weren't always au fait with wearing PPE. You were doing an aseptic technique, and that was probably about it. And it felt really alien to be wearing a mask, gloves, but I think now it's just become second nature, and we have been able to manage with it, haven't we? And we've adapted to it, really.
I don't think for us it feels so much like we're coming out. I know we haven't been in the admissions ward for a few weeks, but it's still been a very, very busy 2 weeks. So it doesn't feel for us that we're coming out just yet. But I think knowing that lockdown will soon be over, some restrictions are going to be lifted. Already, as occupational therapy team, we've been talking about some of the groups that we can be doing. There has been a few more group sessions happening, and I think patients are talking a little bit more about what's going to happen. One of our activity coordinators has got in touch with a bike company, so we're just on the outskirts of it. So talking about what are we going to do, and it's been traumatic, and I think we still need a few weeks maybe that things will settle down and we get back to a normal acute, busy still, but a normal acute ward rather than an admissions ward.
Thank you.
Thank you, Layla. We're coming to a close, and I am keen that we finish precisely at 1 o'clock, as promised. I can't help but take a bit of chair's privilege and say that I historically worked alongside both Pippa and Dolores, but that as the ward's been described, I find it hard to imagine working in that environment, but hearing the way that you've lived through that has been really helpful. I don't know if I would have been, I might have been a member of staff that you would have had to nag because I wasn't keeping to the appropriate distance or whatever, because I find it personally very hard. And just some of the things that you do in an acute ward, and so much of your work is actually about getting people out of the ward and seeing them, assessing their functioning in the community, in their own homes, and in public transport, etc., and with their families. And to not have that immediately available to you in such a direct way must have hampered things really considerably for the whole team, and the function that you have. So I'm tremendously impressed, partly because you're my former colleagues, but also the fact that you've come here and been open with us about some of the very practical measures that you've had to take and how they've impeded progress on the ward, but also how you've responded to Paul's questions, and given us so much of the emotional experience of what it's like to be a professional at such a time. I should say that it's been repeated here, but in the sessions that we had preparing for today, I was struck by this sense, what I was being told by Pippa, that she was pleased to be working, pleased that it gave her a routine, pleased that she wasn't one of those folk, a bit like me, spending most of my time stuck behind a computer screen, often from my own sofa with a nice cup of tea in my hand. So thank you for not just the work you have been doing, but the work that's ongoing as we continue to experience pandemic. I've just been for my COVID jab this morning, so I feel a need to say thank you to the staff who are working really hard to help all of the staff in CNTW get as protected as we can be. And I hope that those messages of some growing confidence within the clinical team to get back to some degree of normality will progress. So I'm going to close the session now. Formal thank you to Dolores and to Pippa. You'll see in the chat when you do find the bravery to look at it that there's lots of thank yous there as well. Thank you to Paul for leading that guided interview so well, and thank you for the questions and the participation from everybody present. If I can just ask the panel to stay on while we say goodbye to everybody else. Thank you very much.